I am Dr. Malcom Doyle. I work at the ProMedica Toledo Breast Care Center, and I've been working in Toledo for 14 years. I did a fellowship in breast imaging at the Henry Ford Hospital in Detroit, Michigan. And I work at the premier breast imaging center in Northwest Ohio. I'm very fortunate to work there because I work with a wonderful group of people, and we're very unique because of the caring expertise that we have here. Molecular breast imaging is a nuclear medicine study, which is excellent for identifying areas of increased metabolic activity in the breast, such as breast cancer. Mammograms are the best screening tool for the general population, but they're not perfect. And women with dense breast tissue are not fully served with mammograms because mammograms rely on distortion of the normal anatomy or architecture to show cancers. And this can be very difficult to pick up in women with dense breast tissue. MBI gives information on the molecular level and is able to cut through the dense tissue and show things that are potentially missed on mammogram. We adopted the LumaGEM molecular breast imaging system 2.5 years ago and have already done well over 2,000 examinations. We were looking for a tool to help screen women where mammograms are not doing the full job because of their breast density or complexity. Since we've used that system, we've now learned that it's also helpful in many diagnostic cases. For example, women with a symptom where the mammogram is equivocal or negative, where additional testing is needed for extra peace of mind. We also looked at screening ultrasound as an alternative, but found that that was very technologist dependent. And although MRI is an excellent screening tool, it's very expensive and not everyone can tolerate that, so we found that MBI was a much more cost-effective tool. I'm very impressed with the LumaGEM molecular breast imaging system, and my confidence with using it has increased with every week that's gone by. We started using it initially primarily as an extra screening tool for women where the mammogram was limited by the breast density or complexity. And we've seen a number of small breast cancers picked up with the molecular breast imaging that would have been missed otherwise with mammogram alone. The thing that's really impressed me more recently is how it's been helpful in working up women that are symptomatic, either with a lump or focal pain, where the mammogram is negative or equivocal, but you just want another test to give additional peace of mind to both the patient and the physician. MBI is very helpful from the patient perspective because it can pick up small cancers that may be missed otherwise on mammograms that are limited by breast density. And catching the breast cancers at a smaller size and an earlier stage is critical because they're much easier to treat when they're at an earlier stage. For the physician, the MBI is a wonderful problem-solving tool. We have a number of issues when patients have multiple findings on the mammogram and ultrasound and we don't know what needs to be biopsied, if anything. The MBI will direct us to what needs to be biopsied, if anything. And also there can be a setting where the patient is symptomatic but has mammograms or ultrasounds that are equivocal, and the MBI will tell us if there's anything more needs to be done. So it gives the physician and the patient much more confidence with the final reading. So MBI has been a wonderful tool for us because it's filled a hole in our imaging needs that were present in the past. Many patients had symptoms or findings on mammogram that were relegated to 6-month follow-up or close imaging monitoring, and that can be very stressful for both the patient and the physician. With the MBI, we're able to work those patients up more fully at the time of presentation, and this is important because it relieves the stress of the patient and the physician and gives the answers in a more quick fashion, and also enables us to pick up cancers that might have been picked up later if we had set them up for the follow-up imaging.